was doing an interview yesterday and we were talking about the fact, I mean, a lot of this funding is very much in the acute side of things, right? Like we're talking about that kind of end part of a patient journey when we're talking about public hospital funding. Is part of the issue that I guess states have very little control over what's happening in that primary care and prevention space as well. And so this has kind of led to a bit of imbalance, or is that completely separate?
I think that it is a big issue. It's hard for states to control demand. They don't have that control over primary care or aged care, important services that help keep people healthy, keep them out of hospital. But even despite all that, I mean, that does create growing pressure on the system. It's a big reason that costs go up year after year. But what we were looking at is even after you're admitted and you're in the hospital, wider costs and practices vary so much. Of course, some variation is needed. But, even if you've got rising demand and you're struggling to keep up, that should actually make you focus even more on the productivity of the care you're providing because you're trying to keep up with that demand and avoid wait times getting too long. So I think sometimes states point to failures in primary care and they say, this is why the hospital system is struggling. This is why we have ambulances ramping outside emergency departments. And certainly it's putting pressure on the system, but it's also no excuse for not getting to the bottom of how we increase efficiency.